Hi, welcome to Healthy Living. We're going to talk today about this patient that has this little area of red and callousing on the bottom of his foot. Now, you can already see there's a problem in this foot. And what happened is this patient, he wasn't born with just 4 toes. What happened is he lost the big toe. And I wanted to explain kind of the importance of the big toe and also the importance of how to be taken care of if you lose it. So this patient is diabetic and ended up losing his big toe a while back because he had a sore, and that sore went into the bone, and he ended up losing the toe because there was a bone infection. That's something that's very common with diabetics. But after someone loses a big toe, there's a couple of things that happen. Well, the first thing is it can affect your balance because you need your big toe to balance as you're walking, and you also lose a little bit of the pushing off factor when you're walking, your propulsion. And he didn't have that, so if he's not pushing off the big toe, where do you think he pushes off? Right underneath here. And this is the area kind of right next to the big toe, and that's where he's pushing off. And if he keeps pushing off in that area and there's no protection, you could develop a callus, and if that callus isn't treated properly or not sufficiently enough, it's going to develop a little bit of blood. If you were to trim off this callus, you're going to find that there's a little bit of a sore or the beginning of a wound on that area. And that wound needs to be treated. He also has another little callus right here, other little callus right here. And what's the best type of a treatment for a patient like this that's missing a big toe and that has these calluses that want to become wounds? Well, the most important thing is this patient should be seeing a podiatrist every 9 weeks or as soon as the insurance allows to have that callus trimmed off. Because if you remove the callus, it's going to remove that high pressure in that area. And then the second thing that this patient should be in is a special shoe that's made for diabetics that's going to reduce the friction on the bottom of the foot and reduce the pressure. And that's called a diabetic shoe. And that's a special shoe that has inserts that can reduce and heal this. And I've actually had some people that have had sores, and the sores have healed up because of wearing diabetic shoes. A few things to mention though. These shoes and these inserts, they need to be worn all the time because they're only working when you're wearing them. And a big question for a lot of my diabetic patients is, well, okay, I'll wear it when I go out of the house, but they're about 90% of the time in the house. So you have to be aware. If you have this, you need to wear the shoes both in the house and out of the house and all the time. And you have to be very careful if you switch to another shoe that doesn't have those inserts in them. Because another big reason I see something like this is that someone, let's say, for example, they normally only walk around the house, but then they decide to take a trip where they're doing maybe a mile walk and they're not used to it. Anytime you're increasing the amount of walking you're doing, you have to check your feet. Check your feet before, check your feet after, see if there's any areas of blisters or any areas of concern, because that can be a big problem on your foot. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.